DC Greens is a nonprofit organization that works to advance food justice and health equity in the nation's capital. Washington, D.C. is not only our nation's capital, but it is also one of the top 5 wealthiest metro regions in the whole country. Regretfully, this wealth has not protected many of our city's residents. Ward 8 in Washington, D.C. is the highest poverty area of the city, and residents of this neighborhood experience disproportionate poor health outcomes, which is why we have partnered with health clinics, a grocery store, and DC Health to offer a produce prescription program called Produce RX. Through this program, medical professionals are able to prescribe fruits and vegetables to low-income patients experiencing diet-related chronic illnesses, including hypertension and diabetes. This allows doctors to give their patients the tools to help them follow their advice to improve their health. While working with our partners to modify the Produce RX program in response to this public health crisis, one of our partners raised concerns around how issues of food insecurity are exacerbated when patients are told they need to quarantine due to COVID-19.
We started working with DC Greens last year through the Produce RX program, and they've established strong and rich partnerships with clinics throughout the city to actually move the needle on food justice. Back in March, leadership at Whitman Walker made the decision to swiftly shift most medical services to telemedicine, and our only in-person services were at our respiratory COVID testing clinics. People would come in for a COVID test, and then we'd often instruct them to go straight home and not resurface for 10 plus days. Food insecurity is an issue for a lot of DC residents. And we know some people want to hit up the grocery store one more time to get some essentials, so anything we can do to help facilitate a safer and more immediate quarantine promotes public health. Andrea from DC Greens asked what we were seeing and how they could help. It was one of the cooler public health movements I've experienced. We've been able to help keep families safe by reducing the need to be out in community, helping to keep sick people from working if they're concerned about earning money to put food on their table so they can focus on their recovery. 2 weeks of food delivered to their door, delicious and healthy produce, and catered frozen meals, enough for 2 people, is truly wonderful. Food is absolutely medicine.
When we heard the clinic's concerns around COVID-19 and food insecurity, we reached out to DC Health to see if they would be interested in partnering with us to design a pilot program to address this problem. We had strong relationships with our clinics and DC Health, but we knew we needed more partners. We needed partners to provide food delivery to people's homes, and also partners to supply and assemble food boxes containing frozen meals, produce, and other food staples. We were able to bring Via, a transportation company, and Occasions, a catering company, to help us with this project and be able to serve our community during this challenging time. The end result is a program through which clinic partners connect patients who are food insecure and who are asked to self-quarantine due to COVID-19 to a program that provides a 2-week supply of food to help them keep their quarantine. The program workflow is very easy. Clinic partners screen patients for COVID-19 and food insecurity and provide a unique code and instructions to patients on how to request a box of food. Patients then place an order by calling the call center, which is managed by our delivery partner Via. And then Via communicates with DC Greens and Occasions, our catering partner, to place the order of food boxes. Once the boxes are ready, Via drivers pick up the boxes at Occasions and then deliver to our participants' homes.
During the COVID-19 public health emergency, remaining connected to your clinical provider, as well as ensuring food access, have been major priorities for DC Health. The COVID-19 public health emergency has highlighted 2 key takeaways. Number 1, this moment is exposing gaps in our food and healthcare systems, and more importantly, presents a pivotal opportunity to develop, implement, and evaluate innovative cross-sector solutions that invest in food as medicine as a preventive healthcare measure. Second key takeaway is that these cross-sector solutions that integrate healthcare and food access systems will require cross-sector partnerships. Building clinical community linkages to close the chasm between clinical medicine and public health is a major priority for DC Health. These linkages connect clinical providers, community organizations, and public health agencies and aim to improve patients' access to preventive and chronic care services. The success of this COVID-19 pilot has been supported by a strong existing partnership between DC Health and DC Greens. During this COVID-19 pilot, DC Health has offered strategic planning, guidance, and public health expertise to DC Greens.
VIA has been a part of the DC community since 2016. And when DC Greens approached our team after identifying food access challenges for students and patients under quarantine, we were able to work together to quickly launch a digital food delivery platform to serve those in need. Since March, we've been using our technology, known by many in the DC area for on-demand shared rides, to instead efficiently plan and route deliveries of groceries and produce boxes to the patients of Whitman Walker Clinic and students at Washington Jesuit Academy. We work with drivers from a ride-sharing service in the area to meet the high demand for contactless, at-home deliveries, and we're glad to bring our driver partners back to work while helping DC Greens efficiently and safely serve more residents at scale.
We believe that the success of this program is mainly due to the strong partnerships and also by having a champion at each partner organization that connects and maintains communication between all partners. COVID-19 is exposing gaps in our food and healthcare systems and illustrates the need for innovative cross-sector solutions and investments in food as medicine as a preventative healthcare measure. We believe it is extremely valuable to share best practices and learn from each other, and we hope this food quarantine pilot is something that can be replicated in other communities.